So with regards to your cervical spine, your neck, the thing we want to protect is your spinal cord and the nerves that exit the spinal cord and leave the spine. So in this model, what we see is the front part of the spine. There are 7 bones, C1, 2, 3, 4, 5, 6, 7, and the bones are separated by the discs. The posterior part of the spine is basically an arch, and when you're feeling your spine, you're just feeling the tip of that bone. That's called the spinous process, and the flatter part of the arch is called the lamina. So in some cases, the spinal cord or the nerve roots can be compressed from the back. In some cases, the compression is from the front. So the approach we take to surgery depends on really where the compression is on the neural elements, meaning the spinal cord and the nerve roots. If you have compression from the back where the ligament under the bone can get thick, or possibly you have a ruptured disc that may be pinching the nerve out laterally, sometimes we can approach that from the back. When we do that, we make an incision in the midline and we'll spread the muscle off the roof of the spine. In some cases, we have to take off the whole arch at even multiple levels to take the pressure off of the spinal cord. That's called a laminectomy or decompressive laminectomy. Our whole goal in neurosurgery is to decompress nerves that are being compressed, and the spinal cord as well. Occasionally, if you have a disc herniation out to the side, sometimes we'll go in through the back to get that disc herniation. When we do that, we make a little window in the roof of the bone, and we find that nerve as it exits. And there'll be a little fragment of the disc, which is the cartilage between the bones, that's squirted out and is pinching that nerve. So we can actually reach under the nerve root and pluck out that fragment. And that's called a posterior discectomy. Not very commonly done, but in many cases it's much better to do that approach than to go through the front and either have to take out the whole disc and fuse or put in an artificial disc.